Hello, my name is Jazz. I am a med-surg nurse at Sutter Tracy Community Hospital, Tracy, California. I was approached by Patty Kelly to work with her on this project to talk about flag system that we use here and fall prevention. So here I am. So when we first came up with the idea in Falls Task Force, because we were looking for something fresh, new, different idea, something other than just the regular signs, because the nurses tend to start having sign exhaustion after a while. So we wanted to make it very convenient for the nurses to use, very easy to use, and for patients and families to understand for their convenience and ease, and economical. Therefore, flag system was born. After Tim Crane, who is our physical therapy manager, he ordered the signs, we decided to pilot it on one unit only first to see how well it would work with the nursing staff and the patients and the families before we went and did a house-wide project and education with all the staff. So we started talking about the idea to our frontline nurses, started educating them on med-surg unit only, and talked about it in our daily huddles with the charge nurses to get them ready to use the flag systems. So when we were ready, we did the installation on med-surg unit and started using the flags. At first, we did hear some concerns from the nurses that small children might play with the signs and they might undo their mobility assessments. But we've been using the signs for more than a year now, and I haven't actually had a single incident where the signs were changed by the patients or the family members. So we've been pretty successful in that. So I then started collecting a lot of feedback from the nurses, and I would hear from the patients and the family members as well. And everybody collaboratively, we really liked the idea that it was not only convenient and easy to use, but it was very economical as well, because we weren't constantly having to replace all the lost or torn, damaged signs all the time. We used to have to go looking for signs because patient would get discharged, nobody would take the paper sign out or change it out for a different patient, so they were getting left behind. Patients were wrongfully identified as a fall risk when they were not really a fall risk. So it solved that problem. So once we had a consistent use on med-surg unit about the flags, we decided also to go ahead and do a house-wide pilot on the other units as well, which is mostly our high fall risk areas, the telemetry dialysis and the med-surg units. So we went ahead and did a house-wide installation and did education with not only the nursing staff, but the ancillary staff as well. So they also knew that if this sign was up, that this patient needed help, or if this person is in a blue zone, that means that they're a fall risk and they can come and get the nurse if the patient needs help. I've also received really good feedback on the flag systems from the patients and their family members, especially the family members, because as we know now, patients, family members, they are a lot more alert and they pay a lot of attention to what's going on in the hospitals. From when we hear news, we read about things that happen in the hospital. So people are out there paying attention to what's going on, and they ask questions. And when we tell them that this is for your loved one's safety, this is the reason for the flag system, this is to identify the correct mobility level so we can help them safely, they feel reassured. They feel like we're taking their safety seriously. And it also helps staff because we don't have as many injuries related to not using the correct equipment. For example, if they're in a yellow zone, they're a moderate assist, and that they might need to use maybe a Sarah steady lift or or assistive devices, walkers and things like that. Or if they're in the red zone, that they are a maximum total care patient, maximum maxi-mover lift, or things of that nature. So it's working well so far with the families as well. So in addition to our flag system, which is obviously color-coded, you might ask, how do you know which color zone to flag your patient for? we have 4 color zones. The blue zone indicates whether your patient is a fall risk or not. So if you have decided, depending on your nursing assessment, that your patient is a fall risk, then you would flag the blue zone. If you, in addition to that, you also need to do a green zone for an independent person, or if they are in a yellow zone, you would flag out a yellow sign to make sure that you know that they need assistive devices or equipment, or if they are a total maximum care patient, then you would flag out a red zone for the flag system. So how do you know which zone your patient falls into? It ties into our EPIC documentation. We use the computer system EPIC. So we have a fall risk score to do for the patient every shift. So the primary RN does a fall risk scoring every shift, and the flags change every shift if your patient's mobility level has changed. Okay, so we have these patient mobilization lift selection guide for patient mobilization tasks. It's a laminated sign that we chose to do for ease and convenience of our nurses. It's posted in every patient's room, and it's easy to use. So if you have identified in your charting that your patient is a fall score 0 to 4, you know that they fall in the green zone depending on this. If you've identified that they are a fall risk score of 5 to 14, you know that they are a moderate fall risk score, moderate fall risk. If you've identified that they are above 14, that they are a very high fall risk. So you would, depending on the list, it tells you, if you are doing patient care, what kind of equipment would be helpful for you to use, depending on your nursing assessment. So as you can see, we've got the flag set for bed B here, and the set for bed A here, and you've got your color coordinated mobility flags, red for maximum assist, green for independent, and yellow for moderate assist. And then the blue one on the bottom is indicating if your patient is a fall risk or not. So you can see, easy to use. You can do maximum assist and fall risk, independent but still fall risk, moderate assist but still fall risk, or independent only. And they're nicely color coded, very bright. You can see them from a few feet away in the hallway, so you kind of know before you even walk in the patient room if they need an assistive device, or if they need 2 people assist or 3 people assist before you even walk in their room. Okay. And that is our flag system.